HIV, or the human immunodeficiency virus, is a virus that attacks the body's immune system. The immune system is our body's defense system, protecting us from infections and diseases. When HIV weakens the immune system, it becomes harder for the body to fight off these threats. HIV infection progresses in stages. Each stage has different characteristics and symptoms. It's important to remember that HIV is treatable. With proper medical care and treatment, people with HIV can live long and healthy lives. Early detection and treatment are crucial. They can significantly slow down the progression of the virus. This essay will guide you through the different stages of HIV infection. We will also discuss the importance of early testing and treatment. Understanding HIV is the first step towards managing it effectively. Acute HIV infection is the earliest stage of HIV, marking the initial period after the virus enters the body. It typically occurs within 2 to 4 weeks of being infected with the virus, although this can vary from person to person. This stage is often referred to as the window period, a critical time for early detection and intervention. During this time, the virus is rapidly multiplying in the body, increasing its presence in the bloodstream. Many people experience flu-like symptoms during acute HIV infection, which can be mistaken for other illnesses. These symptoms can include fever, which is one of the most common signs, headache, sore throat, which can be quite severe, swollen lymph nodes, rash, which may appear on various parts of the body, muscle aches, and fatigue, making daily activities challenging. These symptoms are the body's natural response to the virus, as the immune system tries to fight back. However, not everyone experiences noticeable symptoms, which can make early detection difficult. Some people may have mild symptoms or none at all, leading to a false sense of security. This is why it's crucial not to rely solely on symptoms for diagnosis, but to get tested if exposure is suspected. Acute HIV infection is a highly contagious stage, with a significant risk of spreading the virus. The viral load, the amount of virus in the blood, is very high during this time, making transmission more likely. This increases the risk of transmitting the virus to others, emphasizing the importance of early detection and preventive measures. After the acute stage, HIV infection progresses to the chronic stage, which is a critical phase in the overall progression of the disease. This stage is also known as asymptomatic HIV infection or clinical latency, where the virus remains in the body but at lower levels. During this stage, the virus is still active but replicates at much lower levels compared to the acute stage, making it less detectable. People in the chronic stage may not experience any symptoms or only mild ones, which can sometimes be mistaken for other minor illnesses. They may feel perfectly healthy and continue with their daily activities without any noticeable impact on their quality of life. However, it's important to remember that HIV is still present in the body and can be transmitted to others, even if the person feels well. The chronic stage can last for many years, even a decade or more, without treatment, making it a prolonged period of living with the virus. With effective antiretroviral therapy, or ART, people with HIV can live in the chronic stage for several decades, maintaining a good quality of life. ART is a combination of medications that work to suppress the virus, reducing its ability to replicate and cause harm. It prevents HIV from multiplying and helps to keep the immune system strong, which is crucial for overall health. Regular HIV testing and consistent adherence to ART are essential for managing HIV during the chronic stage, ensuring the best possible outcomes. Antiretroviral therapy, or ART, is the cornerstone of HIV treatment. It has revolutionized the way we manage and live with HIV. ART consists of a combination of medications that work together to suppress the virus. These medications are carefully selected to ensure maximum effectiveness. These medications prevent HIV from replicating, which helps to protect the immune system. By stopping the virus from multiplying, ART helps maintain a healthier immune system. Starting ART as soon as possible after diagnosis is crucial. Early treatment can significantly improve long-term health outcomes. Early initiation of ART helps to preserve immune function. It keeps the immune system strong and better able to fight infections. It also reduces the risk of developing opportunistic infections. These infections can be severe and life-threatening if the immune system is compromised. RT needs to be taken consistently every day as prescribed by a healthcare provider. Adherence to the medication schedule is vital for its effectiveness. Skipping doses or not taking medications regularly can allow the virus to multiply. This can weaken the immune system and lead to complications. This can lead to drug resistance and disease progression. Drug resistance makes the virus harder to treat and control. Regular monitoring is essential while on ART. Continuous checkups help ensure the treatment is working effectively. This includes regular blood tests to measure viral load and CD4 cell count. These tests provide critical information about the patient's health. Viral load measures the amount of HIV in the blood. Keeping the viral load low is a key goal of ART. CD4 cells are a type of white blood cell that HIV attacks. Monitoring CD4 counts helps assess the strength of the immune system. Section 5. The challenge of AIDS, a weakened defense. AIDS stands for Acquired Immunodeficiency Syndrome. It is the most severe stage of HIV infection. AIDS develops when HIV has severely damaged the immune system. A person is diagnosed with AIDS when their CD4 cell count falls below 200 cells per cubic millimeter of blood. People with AIDS have a severely weakened immune system. This makes them highly susceptible to opportunistic infections. Opportunistic infections are illnesses that occur more frequently and are more severe in people with weakened immune systems. These infections are caused by bacteria, viruses, fungi, and parasites that usually don't cause illness in people with healthy immune systems. It's important to note that AIDS is not an automatic death sentence. With proper medical care and treatment, people with AIDS can still live for many years. Section 6. Opportunistic infections, threats to watch for. Opportunistic infections are a major health concern for people with AIDS. These infections can affect various organs and systems in the body. Some common opportunistic infections include pneumocystis pneumonia or PCP, which is a serious lung infection; toxoplasmosis, an infection caused by a parasite that can affect the brain; Mycobacterium avium complex or MAC, a bacterial infection that can cause fever, weight loss, and diarrhea; cytomegalovirus or CMV, a viral infection that can cause eye problems, blindness, and other complications; and candidiasis, a fungal infection that can affect the mouth, throat, esophagus, and vagina. Preventing opportunistic infections is crucial for people with AIDS. This includes taking medications to prevent specific infections, practicing safe sex, and avoiding contact with people who are sick. Section 7. Early detection, early action, the key to HIV management. Early detection and treatment are paramount in managing HIV infection. The sooner HIV is diagnosed, the sooner treatment can begin. This can significantly slow the progression of the virus and improve long-term health outcomes. Regular HIV testing is crucial for anyone who is sexually active or shares needles. HIV testing is the only way to know for sure if you have the virus. There are different types of HIV tests available. Some tests can detect HIV antibodies within a few weeks of infection. Others can detect the virus itself. If you test positive for HIV, it's essential to seek medical care immediately. A healthcare provider will conduct a thorough evaluation and recommend the appropriate treatment plan. Section 8. Living a full life with HIV treatment and care. Living with HIV is a lifelong journey that requires ongoing medical care and support. With proper treatment and care, people with HIV can live long and healthy lives. Antiretroviral therapy, or ART, is a lifelong commitment. It's essential to take medications as prescribed and attend all scheduled medical appointments. Regular monitoring is crucial to ensure that the treatment is effective and to make any necessary adjustments. In addition to medical care, it's important for people with HIV to adopt healthy lifestyle habits. This includes eating a balanced diet, getting regular exercise, getting enough sleep, managing stress, and avoiding smoking and excessive alcohol consumption. Section 9. Breaking down stigma, support for those affected. HIV stigma refers to the negative attitudes, beliefs, and behaviors directed towards people living with HIV. Stigma can prevent people from getting tested, seeking treatment, and disclosing their status to others. It's crucial to remember that HIV is a medical condition, not a moral failing. People with HIV deserve compassion, understanding, and support. There are many resources available to help people living with HIV cope with stigma and access the support they need. Support groups, online forums, and mental health professionals can provide a safe and confidential space to connect with others, share experiences, and receive guidance. Section 10. The future of HIV research and hope. Significant progress has been made in HIV research and treatment over the past few decades. Scientists are continually working to develop new and more effective treatments for HIV. Current research focuses on finding a cure for HIV. While a cure is not yet available, researchers are exploring various approaches, including gene editing and immunotherapy. There is also growing hope for a vaccine to prevent HIV infection. Several vaccine candidates are currently in clinical trials. Despite the challenges, the future of HIV looks promising. With continued research and innovation, we can strive towards a world without AIDS. Section 11. Take charge of your health. Get tested, get treated. Understanding the stages of HIV infection is crucial for everyone. Knowledge empowers us to take charge of our health and make informed decisions. If you are concerned about HIV, get tested. HIV testing is quick, confidential, and often free. Early detection and treatment are essential for managing HIV and living a long and healthy life. Remember, HIV is treatable. With proper medical care, support, and a positive outlook, people with HIV can thrive. Let's work together to end the HIV epidemic.